Uterine fibroids treatment. Which is right for you? Many women develop uterine fibrosis, and depending on how badly affected they are with the symptoms, will decide on the course of action they will take, if any, to treat the condition. Uterine fibroids treatment is generally not needed by the majority of sufferers, but in some cases, the feeling of discomfort or fulfilling the need to have children will necessitate the use of some form of treatment. There are some medications available on prescription that will ease the effects of the heavy blood loss and pain associated with fibroids. However, these are only to relieve the symptoms and do not reduce the size of the fibroids. Sometimes using certain medications will give added weight gain, be a cause of depression, and cause hair to grow in places that are not generally normal with women. Surgery to remove the fibroids is available, and in the more extreme cases, women will opt to have a hysterectomy, losing any chance they had of giving birth to children. There is a minor form of surgery that will use a restriction and reduce the blood flow into the fibroid, causing it to reduce in size. Increasingly, though, now a greater number of women are turning to natural remedies for uterine fibroids treatment. By changing their diet and lifestyle significantly, they are combating the symptoms associated with uterine fibroids and leading increasingly normal lives again. There's a lot of research taking place into the uses of different natural remedies and the way they react with uterine fibroids. Sufferers have reported success when they had given up all hope in finding any relief and were considering the surgical option to relieve their conditions. A valuable research medium is the internet, and careful research will give you answers and patients' own experiences with some of the natural remedies that are available to try. Although it has not yet been fully established what causes uterine fibroids, research indicates that different factors may be responsible for them. Research has also shown that women who can trace their heritage back to African descent are more susceptible to getting the condition and also tend to get it earlier in their childbearing life cycle. Uterine fibroids treatments are becoming more popular now as women seek to relieve the symptoms and pain that is associated with the condition. Most women with the condition do not require treatment because there are no symptoms present. Any symptoms that are present will include heavy loss of blood during the menstrual cycle, additional loss of blood during the monthly cycle, frequent passing of urine caused by extra pressure on the gallbladder, pain in the lower part of the back, and aching in the abdomen. In conclusion, the form of uterine fibrosis treatment you select is by all means a matter of personal choice. Good research of the treatments available will allow you to have an informed opinion of the types of treatment on offer and will help you decide what course of action to take to relieve your discomfort.